At Revive Upper Cervical, we believe that the health of a family starts with the parents and especially the mom. There is research out there that talks about how expecting mothers that are under chiropractic care have shorter durations of labor time as well as less painful labors. And you can imagine the strain of the birth process on a newborn baby and an infant. And so a healthy individual starts at birth, whether even before birth, the health of the mom and then the health of the child immediately following the birth process.
Oftentimes in a chiropractic setting, we get asked, is this something that is safe for expecting mothers? Is this something that's safe for children? And the answer to both of those questions is absolutely yes.
Is it a scary thing? No. Is it like some people, when they think of the chiropractor, they think, oh, you take your kid to a chiropractor, are they cracking his bones?
No, not at all.
So how would you describe it to a friend or family member, what it is that we do? Really?
Just to use the gentle movements and sometimes just this puffs of air just to really manipulate.
Yeah. We have a little instrument, actually, it's about the size of this pencil right here that puts little percussions into the C1 bone to gently realign it.
Those are actually very important times to really get your spine checked and make sure that everything is functioning well and optimally so that you can be in your best health. When it comes to pregnancy and expecting a newborn, making sure that your spine is in alignment allows you to make sure that you've got plenty of room for baby to grow and develop, and also make sure that everything is functioning the way that it should. You want your nervous system to really kind of be in its prime and functioning optimally so that your pregnancy goes well and smoothly, and that transitions oftentimes into a smooth labor and delivery as well.
So a healthy family very often starts with a healthy mom, because very often moms are majority caregivers in a lot of times. And similar to how when riding in an airplane they say to put the oxygen mask over yourself before putting it over your child, you as a parent really need to prioritize your health in a lot of ways, as much as, or maybe even more so than the rest of the family, because if you're not healthy, you won't be able to take care of your child the way that you need to. And in preparing for labor, chiropractic, like I mentioned earlier, has shown to be effective in labor times and reducing pain in labor. After labor, the spine has been extremely destabilized. It's a very stressful thing to go through physiologically as a mother. And so we really want to be there for you, both in preparation for labor as well as soon thereafter.
We oftentimes forget is how traumatic that birth process can be on not only the mother and her body, but also the baby. Specifically the spine, and even more specifically the neck. A lot of times there can be some tugging and twisting and pulling on the neck, which is a very fragile, delicate area and something that we want to definitely make sure that we're taking good care of.
And it's really interesting. You said a few things in there that I think probably happen so much to people. Number one, head tilt. Very often our babies will prefer that their head is always in one side. Yes. They're always looking in one side. And so often we just think it's normal. We just go, no big deal, this, that, and the other. But it's kind of like a tree growing out of the ground, And if it's leaning to one side, it's a little twig is leaning to one side, the tree is going to grow that way, And it's like, they may grow out of it, but what that means is they adapt to it. Yes, they adapt to it.
Oftentimes, the harder that process is, the more issues may start to develop within that child. So often we maybe are seeing babies with colic or difficulty with feeding, they're not sleeping very soundly through the night, and a lot of times they just kind of seem like they're just an unhappy baby. A lot of times that is a good indicator for us to step in and do a thorough exam and just kind of see, is this a situation that we can help? Is there something going on within the neck that can change the quality of life for this child and help them to grow and develop and be a happier kid?
So if your child is struggling, or a young parent whose child is struggling to thrive or just do well, or is constantly going to the pediatrician and constantly being given more and more prescriptions, we would love the opportunity to help. Our office always offers a complimentary consultation and screening where we will sit down with you discuss the health history, discuss the pregnancy and labor and how they went, how the child's been doing, do a very precise and thorough evaluation to see if there could be some spinal problems contributing to their current healthcare concerns, and lay out a roadmap that might involve spinal care in this facility, or it might involve co-management or referral to other providers that we closely work with to give your family the proper options and solutions to get you guys on the road to a healthy recovery and an optimistic and healthy future.